Okay, so picture a growing tumor. But don't think of it as just one single fortress. Instead, imagine it's a huge, sprawling city that needs roads and supply lines to survive and grow. Now, what if you could just cut off all of those supply lines? That's the whole idea behind a really fascinating field of cancer research called anti-angiogenesis. So let's dive right in and explore the question that's driving this entire approach.
Yeah, this is it. This is the big question. It's such a powerful idea, right? It totally shifts the focus from, attacking cancer cells directly to instead undermining the very infrastructure that keeps them alive. It's like a siege. And it all starts by understanding a key weakness.
You know, every powerful enemy has a weakness, a vulnerability. And for a lot of tumors, that weakness is its absolute dependence on a constant supply of nutrients. So to figure out how to exploit that, we first have to understand the natural biological process that it hijacks.
Now, this word, angiogenesis, it might sound a little complex, but it's actually a totally normal and, frankly, essential process. It's how our bodies do amazing things like heal wounds or restore blood flow to tissues after an injury. It's a fundamental part of our biological toolkit. But here's the twist. Cancer cells, well, they hijack this natural process for their own purposes. As a tumor gets bigger, it needs more and more oxygen, more nutrients. So what does it do? It sends out these chemical signals that basically trick the body into building brand new blood vessels that lead directly to it. These aren't just little supply lines. We're talking about superhighways that fuel its runaway growth. Okay, so if we know tumors are building these highways, the next logical question is, can we stop them? Can we put up some roadblocks? And that question has led researchers to explore a whole range of compounds, creating what you could call an anti-angiogenic toolbox.
And what's really interesting is that some of the potential tools being studied are already in our medicine cabinets. Researchers are looking into the off-label use of certain drugs, which just means using them for a purpose different from what they were originally approved for. For instance, the common diabetes drug metformin, and even certain statins, are being looked at for possible anti-angiogenic effects.
And the search doesn't stop with pharmaceuticals. Preclinical studies, so early-stage research, have also zoned in on a number of compounds found in everyday supplements. We're talking about things like EGCG from green tea extract, curcumin from turmeric, resveratrol from grapes. You get the idea. These have all popped up in research looking at how they might influence these nutrient pathways. But, and this is a really crucial point,
This is all about generating hypotheses, not giving answers. The source material is crystal clear on this. None of these are approved cancer treatments. They're simply compounds that appear over and over again in research, sparking discussions and, hopefully, more investigation. So, how exactly are they supposed to work?
Well, it often boils down to interrupting a signal. Tumors send out this chemical messenger called VEGF. You can think of it as a construction order that says, hey, build new blood vessels here. The working hypothesis for a lot of these compounds is that they might be able to interfere with that signal, basically jamming the communication so that the construction order never gets through. You know, the evolution of how we understand this is perfectly captured by the wild story of thalidomide. This drug has a truly tragic past and was abandoned because of its severe toxicity. But then, decades later, scientists discovered it had these incredibly powerful anti-angiogenic properties. And just like that, it reemerged as an approved cancer drug. It's an incredible comeback story that really inspired a much deeper look into this entire pathway.
And that brings us to what is maybe the most important part of this whole discussion. With all of this fascinating research out there, what is the right way to think about it? How do we take a scientific hypothesis and turn it into a responsible, productive conversation?
Okay, let's be really clear about the goal here. The purpose of gathering all this information is not to create your own personal treatment plan. It's about building a mental framework, a way to organize and make sense of this really complex landscape of early-stage research. It's about understanding the categories of thinking in this area of medicine.
So to be absolutely 100% clear, let's look at what this information is. It's a lens for seeing the kinds of hypotheses researchers are testing. It's a guide to help you come up with better questions for your doctor. Now, what this information is not, it is not a treatment recommendation, and it is absolutely not a substitute for professional medical advice. That line between being an informed patient and self-prescribing is a very bright one, and it's so critical not to cross it.
Ultimately, the real power of this knowledge is all about communication. It lets you walk into your doctor's office and have a much more informed, intelligent conversation. You can ask things like, hey, I've been reading about some of the research into anti-angiogenic pathways. What are your thoughts on this for my specific situation? That is the goal, empowering a smarter dialogue.
And that really brings us to the future. This whole field is just a testament to scientific creativity, looking at an old problem from a completely new angle. And as we learn more and more about the intricate web that supports cancer, it leaves us with this really compelling question. Could this strategy, this idea of cutting off a tumor's supply lines, one day become a standard foundational pillar of cancer treatment? Honestly, only time and a lot more research will tell.